again with Professor Ramon Sanchez.
Good morning, everybody. Before I start my presentation, I'd just like to just put something out there. And when we're talking about religion, religion is an emotional response, and no matter what you believe in. So when you put it in that framework in terms of emotions, we can see why we can get all of these issues about discrimination and misunderstandings, etc. So, and it's also a social construct. So it's very, very dependent on where you are. On where you are in, sorry about that, technical difficulties. So it's a social construct. The impact of culture on societies and belief systems impact the way we respond to healing, right? Clinicians have to be very, very acutely aware of that response because we interpret things in many, many different ways. Folk stories, folk ideas, mythology, all of that comes into our way that we view the world, right? Our whole veneer, our whole interpretation of the world comes from our own traditions. So as clinicians, you have to be acutely aware of those types of things in order to incorporate the person into these issues. So symptoms have meaning as symptoms through cultural interpretation. In other words, my symptom of an illness is culturally constructed as well. So if I go the route of understanding the culture to address the symptoms, you can better heal the person. So that's really the basis of this type of issue. For instance, guilt is a common symptom of depression amongst Western societies, right? Whereas somatization, which could be thought to be more easily associated with other class disorders, is common among depressives elsewhere. So these culture-specific messages are misinterpreted by us when they somatize in certain people. And so because of our scientific knowledge in medicine, we discount all of this stuff, right? There's four cultural interpretations that I just want to talk about. The subjective experience. What subjectivity? My interpretation of something. Why am I sick? How do I see my sickness? And the way I view my sickness has to be understood by clinician and me if I'm being sick. So that understanding of subjectivity, including the patient into the healing process, helps the healing. The nature and cause of illness, huge. Huge. You may say my skin cancer was caused by blah, blah, blah. But I may say my skin cancer was caused by some type of issues dealing with egg goon that I have to do some type of cleansing. And then the healing process itself. In Western medicine, you're either healed and you're not healed. The way we deal in these types of healing is we can be healed temporarily until we fall out of sync with our ashe, with our balance in nature. So that's why we need to go to a babalawo. That's why we need to go to do the cleansings, because we fall out of sync with ourselves. So healing is a continuum to us. That's not understood in Western medicine. In Western medicine, you either don't have that or you are sick. So that is a big problem, right? Diagnosis is the problem. That's what I'm talking about. And then the acceptable outcome. In other words, to people in our communities, it's okay to heal myself for 3 months, because I can always go back and change some aspect of my destiny, not my fate, my destiny, through oracular divination, through some of the other issues that we have that address these. This as a cleansing ceremony has to be understood in the context, again, of culture, right? Of the person sitting down, getting the cleansing, has to understand and believe and be part of that what's happening there, and have her or him understand what's happening there. That helps the healing process. all of this doesn't necessarily happen in our Western medicine. Divination. Divination as divination as a construct is a soothing construct. Divination is a psychology of our ancestors before psychologists existed. You're a psychologist. You're a psychotherapist, right? When you do divination. That's what happened, and that's what happens. Our medical doctors today, we go in, they barely talk to us, they ask questions, we respond, and that's it, 5 minutes. That's not what happens necessarily in divination. So, the construct of divination as a soothing part, as an answer to my pathology, as an answer to my sickness, is very important because that's therapy, right? So discounting the priest that gives therapy is really, really bad if you're a clinician, because that should be something that adds to your healing process. In ritual performance, what happens? What's ritual? Ritual is nothing more than nothing less than a recreation of some type of mythology, a recreation of an event that has significance. All ritual. Whether it's Obi divination, caracol, Ifa, whatever, it's a ritual, right? And that the ritual in and out of itself has a healing process, right? And we see it as a healing process because that's the way, for instance, in Lukumí, that's the way we interpret the world. If you don't link that with us, it doesn't work as well. And that's not just true for Lukumí. Remember, back to what I said earlier, religion is emotional. Emoción. It's an emotional response. No one can say Olodumare exists. No one can say Olodumare does not exist. So it's what one person says over another. So that's the idea here. And I'm just going to talk 2 minutes about historical context, because in history, African-derived religions have the word religion is just now coming to be.
Thank you.
Right? We didn't even realize that they were valid as religions up until a few years ago, basically. Maybe a few decades, and that's it. That tells you how African-derived religions have been treated and continue to be treated in the world, but particularly in the United States. So it's armchair anthropology, armchair archaeology. That's who we have allowed to interpret religion through the cultural context, which is not bad. It's good. It was a good start. We need to move beyond that and use it as theology in its purest sense, because Ifa is theology, right? It's theology, just like the Torah, the Bible, the Rig Veda, any other text. Ifa is theology.
We call it a liberty.
Excuse me?
We call it a liberty.
A liberty.
No,
Excellent.
As opposed to religion.
Religion.
It's a liberty because it encompasses the fullness of our existence.
Absolutely. Excellent term. Excellent term. It does encompass. It's an interpretation of who we are. So when we see our sickness, we have to have a reflection of how that sickness is going to be treated through the way we understand, not necessarily a pill, right? That's what I'm trying to get at. So we've allowed all of these knowledges through the colonial process marginalize Lukumí religion in specific. Why? Because of its African issues and because of the issues in the United States. When I ask students, when students of mine ask me, why are African Americans hate so much? I'm Jamaican and I'm not like that. The African American experience was 250 some years of absolute disintegration of the family. That did not happen in Jamaica, did not happen in Cuba, did not happen in Brazil. So the African American experience cannot be paralleled to Cubans, to Puerto Ricans, to Haitians, right? And that's something that we have to understand too. That even amongst our own African-derived religions, we are different. Lukumí is Lukumí. It's Cuban. It's not necessarily Nigerian any longer as a religion, right? So the legacies, and Dr. Tafari talked about, the legacies of the Enlightenment period really did everything to, take out the essential aspects. We were demonized as a religion because this is something that we do all the time. And I tell people all the time, you cannot interpret, right, one religion or belief systems with the vernacular and the language of another.
Yep.
True.
The biggest issue that we can think of in history is Elegba or Ogun. When those orishas were looked at through the veneer of Catholic priests, it was the devil. We don't believe in a devil. So that's an example of, you're talking to me in something that I don't understand, doesn't exist. But we continue to do that. We continue to talk about things and trying to cross the bridge. It doesn't work, right? It doesn't work that way. Tradition versus, we're always talking about one or the other in a dualistic sense, right? I think that we have to study our religions in their own sense. We can't study religions, and we can't look at Lukumí or African-based Obeah or whatever the tradition is through the vernacular and the lens of Christianity or Islam or Buddhism or anything else. It has nothing to do. You can draw parallels, but it is what it is in its own sense without drawing those types of conclusions. So not through the lens of the boundaries, because it's very restrictive of world religions. Another aspect that people really don't understand in our African-based faith is the adaptability that we have. We're very adaptable. We see Shango in Kali or in Thor.
Yep.
And that's beautiful because our Orisha tradition tells us that the truth is widespread and all over the place. So that is non-existent and it's antithetical to Christianity and to Abrahamic-based religions. As we deal with our godchildren and our community in general, I think we have a duty as well to let them know that we have to stop that type of interpretation. And make sure that they understand that Lukumí is Lukumí, Espiritismo is Espiritismo, Abacua is Abacua, Palo is Palo. And we can be members of different ones, but they have their own issues. And that's an issue, see, and that's the colonial process. They lump us all together. They lump everybody of color together because you're all of color. And we're not.
And they are not.
And they are not. Oh yeah, Dr. Tafari hit on it. Europeans and the Eurocentric culture of the United States, you don't have to consider yourself as different when you are the dominant culture.
Correct.
When you're the dominant culture, you don't have to see differences because you dominate. But we know that there's 27, 28 different ethnicities within white culture of Europe. But they don't differentiate themselves because they don't need to. They dominate. So we have the task. And thank you to Carmen Pla. Thank you to Ernesto Pichardo. Thank you to the many others that opened the road for us to begin that process. That's never ending. You started it, but we have to continue it as a community. And that's important. The context of diaspora is, people from one area of the world going into another. That was originally used in term for Jews. When we talk about diaspora, of Cuban diaspora, whether you say Santeria or whether you say Lukumí, we have to talk. I don't even like to use the term Afro-Cuban. I allowed it here because me particularly, why do I have to keep differentiating Afro? As an example, I may have black ancestry, but I look white. But I'm Cuban. So I don't necessarily, the more that we differentiate and distinguish Afro from Cuban, we are discriminating as well. So my view of this is it's Cuban. We don't have to mention Afro. To be Cuban is to be African influenced, or else you're not Cuban. You understand what I'm saying? So to continue to say Afro, Cuban is and includes African. Cuban is and includes European. Cuban is and includes Taino. Right? So we have to stop differentiating because we discriminate. We allow the discrimination. Right? When we say Afro this. No, it's Cuban. It has African influence, but it's Cuban. It's a new thing. It's different. Right? So that Cuban religion, and these are some of the different types of religious expressions that I was talking about. Anytime a religious expression comes in contact with another, it's changed. We've already found particular research where Nigerian Ifa was influenced by Islam in the northern areas of Nigeria. A name of Obadallah, for example, was Allah Shoala. That's an influence from Islam. Right? So there's research to show that this happens. This is normal. And this is the process. Right? Anytime that we come in contact with another community, we are changed and we evolve through that community. So change is good. And the great thing about these types of spiritualities is that we know that change happens. And we allow the change to happen because that's part of Olodumare's creation and master plan, right? Which is great. Now I'm going to talk about a little bit about discrimination in the law. Title 7 of the Civil Rights Act specifically addresses employment practices. These are, if you don't know, 5 protected classes, right? Race, color, religion, sex, and national origin. Of course, religion is a protected class since 1964. What does that mean? It means that we cannot be discriminated against for what we believe in. Because to coin a phrase from Mr. Pichardo, I'm going to use him directly because I love to use his term. It is very, very, very floral. His vernacular is, is to discuss my absurdity over yours. Right? Let's not discuss absurdities. Right? Religion, no matter what I believe in, is protected by U.S. law, and that's what happened in 1993 with the U.S. Supreme Court decision. Not because they liked or wanted to be kind to Mr. Pichardo, but because Jews also sacrifice animals, because Muslims also sacrifice animals, because it happens. So if Mr. Pichardo would have lost in 1993 in Washington, guess what? A lot of other people would have lost as well. So it was not about them liking us or accepting us. Still, it was about let's say okay to these people because we want to continue to exist, right? So establishment of policies and awareness of policies is essential in the clinical field. It's essential to give sensitivity training to people to understand religiosity and the difference in acceptance of religious expression. It's absolutely essential. You need to inform and train managers. Why? Because managers, if they discriminate against you because you have your idea on or because you have a necklace, like Mr. Pichardo says, that's not jewelry. That's not jewelry. That has to be respected as a religious artifact or religious piece that's on you that must be respected. So these types of things are essential in terms of awareness, especially in the clinical field. And I know that Maria and Jose will talk a lot more about specificity in terms of clinical practice later on. So we have to be accommodated somehow. But as an Olocha, or as a practitioner of something that's not Christian, let's just say that, right? You have to tell people, no. This doesn't take, I need to keep this on, right? So it's not about, okay, let them take it off. No, right? You have to demand your rights and say, no, you cannot take that off because of this, this, and this, period, right? So again, as a community, we have to also advocate for our own selves and not allow and continue the discrimination. Not only do clinicians need to be aware of that, but community needs to be aware of that as well. And I think that that's our thing. So, of course, retaliation can happen. And just to go back, you know, as a manager, if you're a nurse that's a manager or whatever else, and you do not know the law very well and you discriminate, ignorance of the law does not save you. Yeah. Oh, you know something? I didn't know. No, that's not going to save you. If people know the law, that's why Mr. Pichardo's called. He'll go in there like a bull nose and say boom, 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 boom. Right? If you don't know the law, people, there are people that do. And that's what's good about these community events, is that it keeps and continues to inform us. So I'm very happy to be a part of it. And I know that Maria and and lastly, retaliation. Retaliation is something that is against the law. But let me just say something, as a practitioner in human resource management for a lot of time, long years, 20-some years, I can tell you that it's very hard to prove, right? It's very hard to prove retaliation and discrimination sometimes. I tell people all the time that you need to take good notes. You need to take names, write down events, dates and times. Because at some point, something's going to happen, and then, oh, wait a minute. Let me get my file out, and no, you did this. Look at all the times that this has happened to me. So we have to be aware that we have rights as a religious community, but we have to exercise those rights. We can't be passive about those rights, right? We have to exercise them out in the open air with everybody else. Without being ashamed of anything. So that being said, thank you very much for your attention, and I give you Maria.